I'm here today with Dr. Wootton. She's a naturopathic doctor at Balance Integrative Health. They're in Burlington at Appleby and Upper Middle. And the other day, Kristin is part of our networking group. The other day, she brought up a pretty interesting topic I thought people would be interested in. With all things going on, people are really interested in boosting or in taking care of their immune system. Kristin and Dr. Wootton had some interesting views on, that's fine to do, but let's take some caution. So, without kind of taking too much time, Dr. Wootton, how did this topic come up and kind of, where did it take us and what did you want to share? Because it was brief the other day.
Yeah, absolutely. So one of the things that I've been noticing for the past couple of weeks is you'll see it online and you'll see it in supplement stores and even with patients is there's kind of been a big wave of people going and purchasing any type of immune supplement that they can find at the store. And some of them can be helpful to strengthen your immune system to some degree, but there's a lot of misinformation out there about how well these supplements are going to work depending on your situation. So one of the big things that I've been focusing on educating my patients about is making sure that if they are increasing different supplements, if they are reading articles, that we have that conversation around, are they taking the stuff that's best for them? Are they taking the right forms, the right dosages? And especially people who are on medications or who have underlying health conditions, we want to make sure that we're using supplements that are safe for them. So that means taking a look at what other treatments that they're doing, what other things are going on, and making sure that none of the supplements, the vitamins, minerals, or the herbs are interacting in a negative way with some of the other things that they're doing. So a lot of it was seeing stores being sold out of stuff online that normally there's not any limit to the inventory that they have in that way. And then providing that education and support for people who just aren't aware that there may be some of those interactions or they may be taking things that they don't necessarily need as well.
Right. And with some of these supplements, it's not always the more the better. Some you may have naturally with your own diet, I imagine. And
yeah, so in general, if you're eating a wide variety of fruits and vegetables, your body's breaking down and absorbing those nutrients well, then there's not necessarily a need to be taking a whole lot of extra of the vitamins and minerals at this point. There's also certain vitamins that are water soluble versus fat soluble, and that can impact their absorption based on when you're taking them in the day too. For example, vitamin D is one of the kind of big things that we're hearing a lot about, and one of the tests that I'll run in the blood for my patients to see, are they deficient in it? Because a lot of people are, but not everyone is. And so it might mean you don't need to take high doses of it if you're not deficient, or if you are deficient, we know exactly what dose your body needs in order to make sure that you're properly supported with that vitamin as well.
Well, I mean, like everything, it sounds like the more information you have, the better. If people wanted to, obviously people are paying close attention to this now. If they wanted to have a chat with you, what's the best way that you're doing that now, given the circumstances that we're all kind of online?
So all of my appointments have moved to a virtual platform. So I'm doing either video or phone consultations for patients or for prospective people who are just wondering if they need a full appointment, if they're not sure if what they're doing is right, they have questions surrounding their health. Then I offer free 15-minute meet and greets both through the phone or through a video conference system that we can chat about their specific health goals, their specific concerns, and make sure that they're supporting their body as well as they can.
That's fantastic. What I'll do is we'll include your kind of social media and websites and things like that if anyone wants to reach out. But I appreciate that. Obviously these are changing times, and I've always known that, or I've always kind of guessed and believed in more information is better. I prefer to have that information from people like yourself and experts like yourself, as opposed to Googling it. The whole Google MD thing, we need to be a bit cautious on. But I appreciate it. I appreciate you spending the time. And for anyone that is even thinking about how to support their immune system, I would encourage them to have a chat with Dr. Wootton at Balance Integrative Health.
Perfect.
So thanks very much.
Thank you. And yeah, it was great to chat.